Hello, everyone. My name is Oluseyi Elizabeth Ododemu, and I'm the founder of Stop Mental Illness Foundation. Happy World Mental Health Day, everyone. Of course, we all know that mental health is our universal human right that should be upheld and promoted for every individual. And in the same way, advocacy serves as a powerful tool in creating awareness, challenging the stigma, promoting access to services, and influencing policy changes, and also empowering individuals and communities. Mental health advocacy plays a crucial role in challenging the stigma that is attached to mental illness, in raising awareness, and promoting understanding of mental health issues. Today, in celebration of World Mental Health Day, I am going to share with you my personal journey as a mental health advocate, starting from my childhood observations and my experience, which shape my drive to make a difference. For those that knows me from childhood, they know that I'm someone that cares about people's well-being. I I am that person that will literally ignore my own challenges and focus on other people's. And then a lot of people recognize me as people's pleaser, but that's not what I'm here to discuss this morning. And perhaps these can provide an answer to the most common questions that many people have asked me. Why did I establish the Stop Mental Illness Foundation? Some may wonder if it's because I or someone close to me has a mental illness. Well, like I said earlier, from a young age, I I observed the stark difference in how individuals with mental illness were treated, which sparkled a curiosity within me, to understand the causes and find solutions to this prevalent issue. So this journey as a mental health advocate began in my childhood when when I will literally, care for everyone around me, want to be there for everyone. And as a matter of fact, this continued to shape my life as I grew older. So give me 40 minutes of your time as I share the story of my journey, starting from my early observation to establishing the Stop Mental Illness Foundation, the impact of advocacy in the stigmatizing mental health issues. And I will also delve into the value of psychosocial interventions and explore the types of interventions that can be effective in diverse cultural contexts. So as a child, I noticed the way people with mental illness were often treated differently from others. Of course, we are all aware of how they are treated in Nigerian community where I grew up. Um, and this is quite devastating, to be honest. The stigma and lack of understanding surrounding mental health deeply impacted their lives, and it struck a chord, within me. So back then in my parents-in-law street, there was this young man who slept literally every day on the streets. He's he was so unkept. Sometimes he was still not stealing, literally. It's just, when you are hungry and you don't even have any means of survival, he has no choice than to, just to pick things from people's shops and start running. And sometimes people just, they will have to run after him and give him that beating, which was not really right. And his presence fueled my curiosity even further. I wonder about the causes of his circumstances and potential solution to address such issues. I became a stay-home mom for 10 years in Spain. I decided to dedicate my time and energy, to delve deep deeper into the field of mental health. I also embarked on extensive research studying various aspects of mental health, including the causes, the impact, available treatments. And despite the challenges of balancing motherhood and research, my passion for advocacy continued to grow. And I never stop, even up to this moment, despite the fact that we have resources constraints. And to further focus on mental health issues, I made the life-changing decision to relocate to the United Kingdom. This move provided me with new opportunities to pursue my academic aspirations in the field of mental health. I enrolled in a university to pursue my undergraduate and later postgraduate degree, immersing myself in comprehensive research and acquiring a deeper understanding of mental health. Motivated by the desire to contribute to the field, I am presently pursuing my PhD to delve even deeper into the complexities of mental health. So my research focuses on identifying innovative approaches to address mental health challenges, examining the impact of various interventions, and exploring ways, to assess mental health care, especially in African community, where mental health issues and the importance is still not, understood, especially by the government and policymakers in our countries. So, inspired by my research and driven by the need for real impact, I established the Stop Mental Illness Foundation, that everyone, which is popularly known as SMIF Smith. So the foundation aimed to raise awareness, reduce stigma, and advocates to improve access to mental health services. So through this foundation, I organize awareness campaigns, educational programs, and collaborative initiative with healthcare professionals, community organizations, and policy makers. And over the years, advocacy has contributed to the stigmatizing mental health issues and raising public awareness by challenging misconceptions and fostering empathy and understanding. Stop Mental Illness Foundation has helped create a supportive, inclusive society for individuals living with mental illness. So the foundation's efforts has influenced policies leading to increased funding for mental health services and improve access to care for those in need. And then I've also conducted research on the role of mental health NGOs in Nigeria, and I can confidently say that the significance of local initiatives in improving mental health access in Africa cannot be ignored. And categorically, I have gained insight from Stop Mental Illness Foundation. So with adequate evidence and the result of one of my research, systematically, we can say that community-based rehabilitation and empowerment programs have emerged as powerful tools for improving mental health access in African continents. And who are those engaging in all these activities? It is a local initiative like Stop Mental Illness Foundation. As someone who has been actively involved in the field for 6 to 7 years through the Stop Mental Illness Foundation in Nigeria, I have witnessed firsthand the vital role that the local initiative play in addressing the unique challenges faced by individuals living with mental health conditions on the continent. So the significance of initiative like Stop Mental Illness in Africa cannot be overstated. That is the truth, because if we look at the government resources and try to compare it with the local initiative resources and the provision of the services for the people in the community, you will also note subjectively, you will notice that this is just the truth. And SMIF, which is also a local initiative, recognize the importance of cultural beliefs, the practices and traditions in shaping mental health perceptions and in treatment-seeking behaviors. They tailor their programs to incorporate cultural sensitivity, ensuring that individuals understood and then supported their cultural context, because the treatment has to be holistic. And it is only the local initiative that has engaged in providing, culturally proven interventions to services to people living with mental illness. So SMIF community-based program adopts a holistic approach to mental health, recognizing that well-being is influenced by various factors. So we provide a comprehensive range of services, including counseling, psychosocial support, skills training, and livelihood support. And we also address the diverse needs of the community. And that is because we are very close to the people. We are very close to the community. We are more familiar with the culture. And through our work in Nigeria, I have witnessed the profound impact of an local initiative on mental health access. It cannot be overstated. Honestly, the provision of services and then the intervention that the local initiative are providing to the community, I repeat again, these cannot be overstated. For example, SMIF served the Nigerian community for 6 years, and we have conducted extensive community outreach and then awareness campaign to destigmatize mental health. We engage the community leaders, healthcare workers, and volunteers. And SMIF raises awareness, educates the public, and encourage help-seeking behaviors. And through my community work with SMIF in Nigeria, I have witnessed the profound impact of local initiative on mental health access. SMIF has served the Nigerian community for 6 years, and what we have been able to do is something that's, I don't want to say this, that the government has not been able to do for many years. They actively build support networks within community by establishing peer support groups and engaging community members. These networks provide emotional support, reduce isolation, and empower individuals living with mental health conditions, to advocate and care for themselves. We also focus on capacity building by training community members, healthcare professionals, the herbalists, and volunteers in mental health awareness and basic counseling skills. Presently, we manage about 40 to 50 volunteers. So this strengthens the support network within the community, enabling individuals to identify and respond to mental health challenges effectively. And then we also engage in advocacy efforts to influence policy changes that prioritize mental health and allocate resources for community-based programs. By collaborating with policymakers, SMI have aimed to create an enabling environment for mental health support. And we're still looking forward to that. We've written quite a lot of letters to the policymakers, to the Nigeria government, and we're still waiting. We hope they'll be responsive and we can collaborate to be able to make, more impact in the Nigeria community. Most importantly, local initiative provides psychosocial intervention. Unfortunately, the African health sector does not acknowledge the importance of psychosocial interventions. And local initiative provides psychosocial interventions, which play a vital role in supporting individuals with mental illness, providing holistic and person-centered care. These interventions recognize the complex interplay between psychological and social factors that influence mental well-being. And from my experience, I can say that psychosocial intervention address not only the symptoms of mental illness, but also the broader social and psychological aspects of an individual's life. They will recognize the interconnectedness of various factors and strive to improve overall well-being by training a comprehensive approach. So these interventions place the individual at the center of their own care. They acknowledge the unique experiences, needs, and cultural background of each person, tailoring interventions to their specific circumstances. This person-centered approach also foster empowerment, self-determination, and a sense of ownership over one's mental health journey. Psychosocial interventions aim to empower individuals by providing them with skills, knowledge, and support to manage their mental health. By enhancing self-care and self-efficacy, individuals can develop a sense of self-control and resilience, leading to improved coping strategies and better overall well-being, which is what people with mental health challenges deeply required. So the type of psychosocial interventions, in diverse cultural contexts, includes cognitive behavioral therapy, peer support program, family-based interventions, community engagement and cultural practice, narrative therapy and storytelling. So, and all these I've mentioned are the psychosocial interventions that community initiatives and local initiatives have been provided to the entire community and those living with mental illness conditions in Africa, as well as their family. I really don't want to go deep into these, but I just received questions that I should explain the types of psychosocial intervention. Okay, like I said, the first one is the cognitive behavioral therapy, which is this is widely used, is used as a psychosocial intervention, and it focuses on understanding then the relationship between thoughts, emotions, and behaviors. And it can be adopted to diverse and cultural contexts by incorporating culturally relevant example, metaphors, and belief system. These ensures that the intervention the intervention resonates with individuals from different backgrounds. The second one is the the peer support programs. The peer support program bring together individuals with life experience of mental illness to provide mutual support and encouragement. These we usually, I think we operate these virtually most of the time because I don't live in Nigeria. So we connect them together. We connect those with life experience of mental illness. We bring them together in a group. And this program can be tailored to specific cultural contexts by promoting culturally diversity and inclusive, ensuring that individual feels understood and supported within their cultural framework. And I can tell you categorically that with peer support program, people feel they are not alone. And it also gives them a sense of belongings and help them to keep a balanced self-esteem. The third one is the family-based interventions. The family-based interventions recognize the influence of family dynamics on mental health and involve family members in the treatment process. These interventions can be adapted to diverse cultural contexts by respecting cultural norms, values, and then communication style within the families. Inclusive and culturally sensitive approaches strengthen family support systems and enhance the effectiveness of intervention. From my experience, we have used this most of the time, especially in a community whereby people with mental illness are, they are segregated from the rest of the family. And this has been so helpful in Nigeria. The fourth, community engagement and cultural practices. So I can say we have done these on several occasions, and the psychosocial interventions leverage community engagement and cultural practices, and it also promotes mental health in Nigerian community. So these can also involve, incorporating traditional healing practices, which is what the project we're embarking on now. We'll begin to implement that, I think, from next month. And then it's involved, ritual and ceremonies are culturally significant and accepted within the community. And then this is because a lot of people, even after taking medication, undergoing therapy, they still believe that they still need to see their pastors, or even their traditional doctor, which is the only way they can be satisfied within them that they've received the intervention, holistic intervention. So engaging community leaders and involving local resources ensure the interventions are culturally appropriate and accepted. And it also gives these people the sense of belongings as well, because you're using their culture, what they deeply believe in. And the last one, which is the fifth one, is the narrative therapy and storytelling. I think this specific technique has been a bit difficult, to use in Nigeria. And this is because of the stigma. A lot of people still find it very difficult, to share their story. But we've been empowering them, we've been encouraging them, we've been educating them. But these specific one, narrative and therapy and storytelling interventions draw cultural traditions of storytelling and oral histories. These interventions allow individuals, to express their experiences, and once they express it, they feel relieved. And they express their challenges and strengths in a culturally meaningful way. And this has helped so many people from different African countries by incorporating culturally specific narratives. These interventions facilitates healing, resilience, and identity reconstruction. I hope Nigerians will accept this because it's still very difficult. We have a column on our website, www.smrhelpnigerian.org, where we've asked a lot of people to share their stories. I still have a lot of people, that share their story, but they don't come out, and they will specifically tell you that, oh, you can't share my story, don't even include my name, and I don't want to share my story. But we're still looking for a way to do this because I believe so much that, psychosocial interventions hold immense value in supporting individuals with mental illness, transcending cultural boundaries, and promoting holistic care. And then to support these psychosocial interventions that I'm talking about, which is the best way, is just the most well that most people can receive healing. And to support this psychosocial intervention, my last research in collaboration with the University of Bedfordshire proposed development theory for a mental health action plan, which align with the Sustainable Development Goals for African country and the integrated community mental health model. So this theory emphasizes on the integration of mental health services into existing primary health care systems and community-based initiative. It recognizes the interconnectedness of mental health with other development sectors such as education, employment, poverty alleviation, and gender equality. So the integrated community mental health model focuses on 5 components. And the first one is the policy and governance. Developing comprehensive mental health policy and strengthening governance structures to ensure that the integration of mental health into National Development Agency. These involve engaging key stakeholders, including government agency, mental health NGO, civil society organization, and communities to advocate for mental health and allocate resources effectively. So the second one is capacity building. So enhance the capacity of healthcare providers, community workers, and other relevant professionals to deliver quality mental health services. This includes training, identification assessments, and then management of mental health and condition, as well as addressing the social determinants of mental health. And the third one is mental health system strengthening. Integrating mental health services into existing primary healthcare systems, including task shifting to empower non-specialist healthcare providers to deliver basic mental health interventions. I think we are doing that already. Our foundation is doing that. We're trying to empower people. We're training people that are not healthcare workers. And some of them already left Nigeria, but the truth, and they are working here as health workers because we have been able to, train them on, the basic tools and skills that they need to be able to support people living with mental illness. And we're glad we did that. These involve establishing referral pathways, ensuring the availability of essential psychotropic medication, promoting the use of digital health technologies for mental health support. And the fourth one is community engagement and then empowerment. So promoting community participation and ownership in mental health and initiatives. These include raising awareness, reducing stigma, and engaging communities in designing and implementing mental health programs tailored to their specific needs. And then this is what the government can only do with the support and collaboration of mental health NGOs. It also involves empowering individuals with an lived experience of mental health issues to advocate for their rights and promote social inclusion. So ISOMA Have is empowering people. We do that as well. But we hope that with the support of the government, we can do more of this. We empower those living with mental illness, to be able to advocate for their own rights and then promote their inclusion. We educate them to make them understand that they're not alone, and then mental health is not something that they cannot discuss, and they shouldn't be shy or ashamed to talk about their mental well-being or their status. And then the last one is the multi-sectoral collaboration, which is foster collaboration with various sectors such as education, employment, and social welfare, and justice to address the social determinants of mental health. And these include incorporating mental health into school curriculum, promoting workplace well-being programs, and ensuring access to justice and social protection for people with mental health conditions. I believe that by adopting the integrated community mental health model and align it with the SDGs, which is then Sustainable Development Goals, African countries can drive meaningful change in mental health services and access. And some ways we can do that is to increase awareness by integrating mental health services into primary healthcare systems and community-based initiative, which can improve access to care, particularly in undeserved rural areas. From my research, I was able to gather that we have just two mental health hospitals in Nigeria, and the two facilities, I think they'll have one in Abeokuta and one in Yaba, specifically Yaba. Yes, there's one in Yaba. So, and I believe that if we can bring this to primary health care sector, this will go a long way for us. Holistic approach is also very important. Addressing mental health within the broader context of sustainable development can foster a holistic approach to well-being. And this is by considering determinants of mental health, such as we look into poverty, education, gender inequality, and then holistic approach can also tackle the root causes and promote comprehensive solution. I really wish, and I'm looking forward to a day whereby Nigeria government, they can actually adopt and adapt this system and this model. So if we can also reduce the stigma, community engagement and empowerment strategies can reduce stigma and discrimination that is associated with mental health conditions. So from my experience, by involving community in mental health initiatives, the model also promotes social inclusion and encourages a supportive environment for individuals with mental health challenges. This is, I don't know. I don't like talking about this because this is basically the cost and effectiveness by investing in mental health, integrating mental health into existing health system, which is then often most cost effective than establishing standalone mental health services. And then why I said this is heartbreaking is because the Nigerian government are not investing in mental health services. And it's really sad because I work in this sector, and then I have worked, with so many people. I've witnessed so many people living with mental illness, people attempting suicide, supporting them, and it feels very sad to me. Is a topic I don't really like discussing, because it reminds me of the people that we've supported, and how they have not been able to access the services in Nigeria. And it's so sad. It's so sad. I don't like this. It's a topic I don't like talking about. So sustainable development, by prioritizing mental health as part of the sustainable development goals, African countries can actively work towards achieving goal 3, which focuses on ensuring healthy lives and then promoting well-being for all at all ages. Improve mental health contributes to better educational outcome, increase productivities, reduce poverty, and enhance social cohesion. I like to conclude that mental health challenges transcend the boundaries of healthcare and extend into areas such as education, employment, social welfare, justice, and community development. By recognizing these, collaboration among stakeholders from diverse sectors become imperative to address these multifaceted dimensions of mental health effectively. I'm not going to lie to you. We need this multi-collaboration. We need the community engagement. We need the family of people living with mental illness. We need stakeholders. All of us with the government need to come together to do this. So multi-sector partnership bring together the expertise, it brings the resources and perspectives of different stakeholders, enabling a more holistic and integrated approach. Moreover, multi-sector partnership for mental health are very, very vital for creating comprehensive frameworks that address the interconnected, multidimensional nature of mental health challenges. Collaboration among stakeholders from various sectors unlock the potential for innovative solutions, enhance awareness, optimize resource allocation, and then amplify impact. By working together, I believe we can foster a society that prioritizes mental health, promotes well-being, and ensure the holistic development of individuals and then community. Thank you very much. So, today, on World Mental Health Day, let us commit ourselves to the empowerment of mental health through advocacy, access, community support. We can create a Nigeria where mental health is prioritized, understood, and supported. Let us work hand in hand, fostering a society that values mental health as a fundamental human right. Thank you, and let us embark on this journey of empowerment together.